Been dealing with chronic shoulder pain that was diagnosed as an injury to the rotator cuff. Done lots of PT, injections, and now considering getting surgery to help fix the issue. In this video, I explain why getting a rotator cuff repair could make the shoulder pain worse. So, the most important question to consider here before jumping into a surgery: was there a direct injury or accident to the area, or did it seem to come out of nowhere? If it seemed to come out of nowhere, then the chances of a poor outcome from surgery are actually much higher. So, how did it happen in the first place? So, over time, with bad postures, stress, sitting too much, maybe doing too much, this stuff called adhesion, also known as scar tissue, builds up in and around the muscle. And it starts in what is called the capsule first. So, the capsule is kind of like a anchor for the shoulder. It really dictates the movement of how everything's going to go. So the adhesion first starts to build up inside of this capsule. Now the shoulder really can't move how it's supposed to, but you don't really notice a lot of pain or discomfort quite yet. Then eventually it does get stuck to the muscle, and then the muscle becomes weaker, less flexible, start to notice it a little bit more. Then eventually it does get stuck to this tiny nerve called the suprascapular nerve, which actually controls two very important muscles in the rotator cuff: the infraspinatus and the supraspinatus. Now the whole area is less flexible and weaker, and a lot of times the force has to go somewhere, and now it goes to the tendons and the joints, hence getting the tear. The tear is the effect, not the cause. I say think of the tear in the rotator cuff as like your thumb and it's stuck inside a car door. The car door is all the surrounding tissue around there. We have to get the car door off of there before ever helping to fix the thumb that's been stuck in the door. So that's why a lot of people jump into surgery for rotator cuff repair, but they're fixing the effect, but not the true cause. So how do we address this in our clinic? First is we safely and effectively treat the adhesion around the nerves first, then the muscles, and lastly the ligaments. This improves mobility and function back to the area and takes the pressure off the tendon. Then we build up strength in the area with some corrective and focused exercises. Best case scenario, I say to people, is the pain is going to significantly improve and function continues to get better and surgery isn't needed. Worst case scenario, the pain is still there at some level, but the tissue is healthier, and doing the surgery will actually have a better result because it will be in a healing environment. No matter what, the bad tissue must be addressed, and it's a heck of a lot easier to do it early in the process instead of after a surgery when there is more adhesion and scar tissue built up. So if you've been dealing with shoulder pain for at least 6 months, you've seen at least two other providers with little or no relief, then click the link in our profile to request a no-charge consultation with one of our dedicated providers.